Good evening. My name is Kaitlyn Simmons. I'm a senior in the Family Nurse Practitioner Program. My project for the Create AState Symposium is titled Tobacco Use Counseling Rates in Adult Tobacco Users within a Local Arkansas Primary Care Clinic. Tobacco use, including smoking cigarettes or cigars or smokeless tobacco, remains the leading cause of preventable death and disability in the United States. 31.4% of Arkansans reported using tobacco products in 2016, with 5,800 Arkansans dying from tobacco-related illnesses that year. The United States Preventive Services Task Force created a guideline in 2014 regarding tobacco use in adults. It's titled Counseling and Interventions to Prevent Tobacco Use and Tobacco-Caused Disease in Adults and Pregnant Women. This guideline recommends for providers to first ask about tobacco use, then provide tobacco cessation counseling and interventions for those who do use tobacco products. The national survey that inspired the task force to create this guideline was conducted from 2005 to 2010. The survey found that adults were screened for tobacco use 65.5% of the time in the primary care clinic setting and received tobacco use cessation counseling only 20.7% of the time if they stated that they used tobacco products. Therefore, the purpose of my study was to compare the local Arkansas primary care clinic compared to this national average of 20.7%. I wanted to see where a primary care clinic in Arkansas stood compared to the national average. I first conducted a retrospective chart review, viewing charts from January 1st to November 19th, 2019 in a local clinic. I searched for the ICD-10 code Z72, which is screening for tobacco use, and found that 100% of the patients within this time period were screened for tobacco use. I then performed a second random retrospective chart review to find the first 100 patients that answered yes that they currently used tobacco products during that time. I then cross-searched for the ICD-10 code Z71.6, which is tobacco use cessation counseling. Of the 100 random charts, I was absolutely shocked to find that 100% of the patients had received tobacco use counseling. As a reminder, the national survey conducted resulted that only 20.7% of tobacco users received this tobacco use cessation counseling within the entire United States. But 100% of the tobacco users at this local Arkansas primary care clinic received tobacco counseling. The result of my study showed that the providers at this particular clinic understood the importance of following the guidelines recommended by the United States Preventive Service Task Force. By abiding by these guidelines, patients are at a greater chance of tobacco cessation and increasing their overall quality of life, as well as increasing the health of others by reducing secondhand smoke. The providers at this clinic are striving to increase the overall health of their patients. An action plan recommendation would be for these providers to share their strategies for screening and counseling patients for tobacco use cessation with other clinics within the area. This would help our overall number of tobacco users in this state, which is 31.4%, to hopefully lower and to help lower it within our community even further of Northeast Arkansas. I would like to acknowledge Dr. Chris Jordan and Dr. Mark Foster for helping me with this project. You can see my references were listed below, and please contact me if you have any questions. Thank you.